So, good morning. This faculty development program on systematic review and meta-analysis. As you are aware, ILBS has got a technical resource center funded by Department of Health Research, and we have already conducted three workshops basically on systematic review and meta-analysis, where there were more than 690 registration from 25 states and union territories. Many of the faculty members also joined in this workshop, and director sir had asked us that every faculty person should be trained on these aspects. But faculty found it a little difficult to be there for 3 days, and some of the faculty members have been there. So it was thought that we should have a faculty development program, and in this regard, we are actually having two activities. One is these are the faculty development series, where we have series of 5 lectures, and first lecture on step-by-step uh, procedure was given by Dr. Kanika on 15th of June, and we'll have 4 more series on every Monday in this hall. In addition, just for information, we also have an online 14 lecture series on Saturdays from 11 to 12, coordinated by Shivani from TRC, which is open to everyone and people can join. And that is the ongoing activity. 3 lectures have been done. So with this background about the series, I would request Dr. Aravind Gandhi, who is basically PI from TRC at AIMS Nagpur, and he has got significant experience in systematic review guideline. He has 70 research paper in peer-reviewed journals, and he has been faculty in all our training workshops so far. So with this background, I would request Dr. Aravind for his.
So thank you, sir, and I would like to thank Dr. Kanika as well for inviting me to be a resource person for this August audience. So I hope I'm audible. If anyone can confirm once again.
Yes.
Yes, Alan, you're audible.
Okay, thank you. So once again, very good morning to all the audience here, along with the director sir and the PA and co-PAs of the Technical Resource Center, Department of Health Research Center for Evidence-Based Guidelines. So as I heard from Dr. Kanika, you have already been introduced to the concept per se regarding the systematic reviews, the overview of conducting systematic reviews, more specifically the steps in conducting the systematic review, as well as the final culmination of a systematic review before it is fed into a guideline, that is grade assessment. So in this specific session, we'll be talking about one of the key steps in systematic reviews. Systematic reviews, as the name, the name of the concept goes, it should be systematic in all ways, in all the steps that are being undertaken. So what do we mean by systematic? The step that should be replicable and transparency should be there. And both of these make sure that the review which you are undertaking is systematic. And in fact, that is what differentiates a systematic review from narrative review. Now, in this systematic review, and as would have been explained by Dr. Kanika in the last session, the foremost step of any systematic review is same as that of primary research. You search for a research question or objectives, the primary research question which you are trying to address. That is the first step in doing a systematic review. And a good research question always make sure, at least if not half the way, at least 30–40% of the path is covered by means of a good research question itself. Now, the next logical step in a systematic review is, okay, you have framed the research question. Now, the next step is to look into the sources from where you can identify the studies which can answer your research question. So as you all know, in a systematic review is a type of a secondary research. And in this secondary research, we don't look for individual patients, we look for studies which have been done on patients. So what we are trying to do is that we are trying to collate all the primary studies that have been conducted in that particular topic, obviously, which can answer our systematic review question. Now, once you framed the research question, the natural logical next step is to look for the answer and to start and where to start looking for the answer. That's where your database search of studies for your research question comes. So in this specific session, we'll be focusing on what exactly are the databases you need to look into whenever you are trying to search for eligible studies to answer your systematic review question. And even before that, why do we need to do this literature search in general? And followed by once we run through the databases that you need to look into for answering your research question, we will also discuss one of the major databases, that is Medline or PubMed Central. We'll discuss what are all these terms, what is PubMed, what is PubMed Central, what is Medline in detail in the due course. So we'll be focusing on one of the database, that is Medline through PubMed, and what are all the principles in undertaking PubMed search that we'll be discussing, followed by a short session of demonstration on how to actually undertake a PubMed search. So just to give a brief heads up, even though this particular session is placed in within the systematic review series of workshops, the skill of literature search is not exactly or exclusively restricted to doing a systematic review. So if you are well versed in literature search, that is database search, at least in PubMed search, your primary research question and the methodology can the quality of the primary research question and the methodology in which you would undertake the primary research itself can can improve in exponentially. So even if you are not that much into systematic reviews, but I would suggest to pay attention to this session so that you can improve your primary research as well. So moving on, the basic question comes: why exactly should we perform a literature search? I'm sorry. So the fundamental idea or the rationale behind doing literature search is just like how why do we do for a primary research. So whenever you start writing a protocol for your research proposal, the first and foremost thing which any funder, or be it intramural or extramural, they ask us, why do you want to do this research, right? So we need to take out the background details or background information regarding that specific condition and what exactly that has already been conducted on that particular topic so far. And from this, you move on to the gap part. So, okay, this has been done so far. Now what remains to be done? Right? So this is what you do literature search from your primary research point of view. So the fundamental understanding or the logic behind doing literature search is what is the current state of knowledge on that topic, what has been published, and what are the gaps. Now, from these perspectives, one of the answers, that is what has been published, that is what we are more interested in when we are conducting a literature search from systematic review point of view, because you have already finalized a research question, right? Now you want to see, okay, what are all the studies that can answer this research questions are present in the existing literature. So the primary objective behind doing a literature search in a systematic review is we need to, or you need to take out a potential list of studies that have been published on this specific research topic. Now, this is the objective of doing a literature search from systematic review point of view. Okay, then comes the question, okay, I want to do literature search or database search. So where to look for? Here comes the sources of literature search. So most of you might have already aware of it. The common sources, as you know, for any literature search from a primary study point of view is uh, many of us initially, at least even myself, I was doing just a Google search, or somewhat, as we came into the academic domain, we started doing Google Scholar search. But are they enough, or let's say, can we include them in systematic reviews? The one-line answer would be no. So systematic reviews, as I mentioned, the term systematic is very important and reproducibility is key. So whenever you say you have searched a particular source, the person who is not at all related to your research, they should also be able to replicate the same search and they should be getting the same results. Only if this is feasible, then we can call that as a reproducible search. So that is feasible only in a specific repository called as databases. So you might already be knowing about these databases. So databases are nothing but which can help you to they are a repository where the articles published in journals are indexed in certain order so that we'll be able to retrieve them using a systematic search queries. And not just that, not just you, but anyone else who uses the same systematic search query as developed by you, they will also be able to retrieve the exact same number as well as same set of studies. That is what we mean by databases. So some of the databases you would have already come across. Medline. Medline is the National Library NLM National Library of Medicine US's database, which is kind of primary for all the medicine and health related literature. So we do see a journal as of high quality, a medical from medical and health perspective. If it is been indexed in Medline database, then you have Cochrane Library. So that's Cochrane database. So there, they primarily index systematic reviews and randomized control trials, which are being done and which can be used to inform the systematic reviews of intervention studies. Primary since this is because Cochrane primarily focus on interventional diagnostic accuracy studies. Then Embase, Web of Science, Scopus. So Embase is, if it is an interventional, especially drug-related pharmacological studies, Embase is the go-to database. Scopus is for psychological, social science research. Scopus is a much larger database, larger than Medline or Cochrane Library, but it has majority of the articles that are being indexed is from a social sciences background, because this is Scopus is actually domain neutral. So it's not exclusive to medicine or health sciences, unlike Medline. So Scopus is much more a broader database. Then you have CINAHL. CINAHL is primarily a nursing related database for all the nursing related studies. If you are conducting a systematic review, which includes nursing component or nursing care related interventions, then CINAHL is one database where you can search. Then you have PsycInfo, which is specific for psychiatry and psychology related research papers. These are the common databases. Again, this is not an exhaustive list. You have Chinese databases. What I'm trying to say is the local vernacular language databases are also there. Even though in our country it is not well developed, it is somewhat developed in Chinese and some other languages such as Russian and Spanish. So you do have other databases, especially particular to those languages where they include manuscripts and journal articles that are published in those local languages. But for our practical purposes, since we are going to include, most of us will be including only English published articles in English language. So these are the databases you should be aware of whenever you are writing a protocol for your systematic review. So you should specify the databases which you are going to take out. Now, the next another source for finding out studies is clinical trial registry. Now, this is one place where you'll be able to find the studies, especially in a very novel concept, and majority of the studies have been are ongoing or only recently concluded. Obviously, it will take some time for it to come out in the peer-reviewed publication, right? So only after it comes in a journal publication, that goes for indexing. That might take some time. Again, indexing takes 1 or 2 months. So this time gap can be overcome if you can search the clinical trial registry directly and take out the results from it. But the one caveat is that it has not been peer reviewed, and in fact, you should be the one who will be doing a kind of a detailed peer review for those articles in order to ensure that it adheres to all the methodological and statistical quality. These are the common sources which we look into. Now comes the another important thing. What is PubMed or the Google Scholar? Let's talk about Google Scholar. Is it a source of, or let's say, can it be used as a source for database search or literature search when we are undertaking systematic reviews? Now, some of you might have come across this being mentioned as a source of literature search in the in the systematic reviews which you would have read, right? But Google Scholar is not a database. That should be the starting point. So never ever point or let's say mention Google Scholar as one of the databases you searched for your systematic review. This is because for that we need to remember what exactly is a database. Like I mentioned in the beginning, a database is something where the reproducibility of the search can be done. So if I do a search in, let's say, Embase, and I have the search query with me, and if we share the search query with someone else, they'll be able to replicate the same thing. Whereas I cannot do the same for Google Scholar. Every time you search, even with the same keywords, it might be giving different hits or different priority of articles that are arranged in the Google Scholar page. So that is the primary reason why Google Scholar cannot be called as a database, but you can keep it as a secondary source of research, literature search. Always, you can always mention two sources, primary sources where you can keep databases and clinical trial registry, since that search is very much replicable. And there are other sources which you can put under secondary sources or secondary search. So one thing can be Google Scholar and other open repositories. So you do have PhD thesis being submitted to repositories. So in India, we have this Shodh Ganga. And again, as you know, majority of the thesis, they don't get published. But again, that's a huge area of gray literature which is being missed out, right? So you can go into those open repositories such as PhD thesis, Shodh Ganga, etc., and then you can search there as well. Especially if your topic is very novel, and not many of the studies are coming out in these database journals, then obviously we have to search for other secondary sources such as in Google Scholar and in open repositories. Then there is always this manual search of online journals. So as a subject expert, you all know what are all the high impact factor journals on the specific topic. If it is if it is related to liver and biliary sciences, you do know there are some top 10 journals which are high impact factor journals which publishes good quality articles on the specific topic. So you can go into the respective journals websites. You can look into their, okay, you can again pre-specify that in your protocol. Okay, we will look into the last 1 year published issues of all the articles in these journals. Manually, you will go through their issue and the article title abstract. Then again from there you can try to identify any potential articles. Then not just that, you can even go into the reference section of the key articles. So whenever you start a systematic review, you might already be having certain seed articles or parent articles, which might exactly fit your research question. Sometimes we start asking a systematic review question from a already known primary research study which is with us, right? So let's say some 3-4 studies you already are aware of. Then you can go into the reference list of those studies, and you can obviously that study would have cited some relevant studies or related studies which have been published on the same topic, either in their introduction or in their discussion section. So you straight away go to their reference section and you can look at their title, and from there you'll be able to identify some of the potentially eligible articles. And finally, even though expert opinion is considered as the last, or you can say least in the evidence hierarchy, obviously you can ask the opinion, or let's say you can ask the experts to point out towards some studies which have been completed or forthcoming, because they will be the ones who will be knowing, okay, what exact studies are ongoing and about to be completed or completed, but in the process of getting published, right? So you can always take their opinion to identify such studies which are in the pipeline, and sometimes which may not be, you may not be able to identify them in the clinical trial registry. So these are the primary sources where you can look into, or where you have to go for undertaking a literature search. Now comes the logical next question. Okay, there are, there are a lot of databases for systematic reviews. So we will come, what databases will you be selecting for systematic review? Even though I have mentioned so many databases, so we'll be focusing mainly on the databases which are relevant to our research question. So just to, for completion's sake, so at least 3 databases should be chosen whenever you are undertaking systematic reviews. And those three databases should be relevant and pertinent to your research question. If your research question involves some psychological or a social science related concept, example quality of life or psychosocial well-being, so Scopus is one database which you cannot miss. If your study is about interventional meta-analysis, including RCTs, then Cochrane Library is one database which you cannot miss. And for whatever may be the study, if you are conducting systematic review from health and medical domain, Medline is one database which you cannot leave out. So at least three databases, and what three databases, that depends on your research question. Now we'll move on to the hands-on now. Now before moving on to the hands-on, I would like to clarify certain things regarding PubMed, Medline, and PMC. PubMed is a search engine. It's more like a Google. Medline is the database where the articles published in the journal actually gets indexed. And PubMed Central is an archive for open access articles which are allowed by the journals, and they submit the full text articles in the PubMed Central. So it is basically an archive or a repository for open access articles that are published mostly in Medline journals, but sometimes some of the journals will be in their journey to get indexed in Medline. So before getting the Medline indexing, they will be allowed to go for PMC. So you will be able to find the full text article in them. So Medline is the actual database. PubMed is only a search engine of the database. PubMed is Google for Medline. So whenever someone says an article is PubMed indexed, you need to introspect properly. You need to go into the journal and check whether the article is PMC, PMC or Medline. So I'll not go into this. So I'll just mention the four principles which you need to keep whenever you are going for a PubMed search. Never do a Google search in PubMed. That is copy pasting the entire research question. It is always good to split the research question on according to the components. For example, as you know, for an RCT, it will be PICO, right? Any research question pertaining to RCT will have these four components: population, intervention, control, and outcomes. So you split it into these four components, and then you can proceed to do a literature search. But the most important thing, never do a free phrase search. That is, never do a Google search in PubMed. Just like how we copy paste the whole entire sentence in Google, we should not do that in PubMed, because PubMed works by a different algorithm. Next important thing is you should always you should do a mesh search. Now what is mesh? Mesh is nothing but indexing. Whenever an article whenever an article published in journal indexed in Medline gets published, so people in Medline, or let's say National Library of Medicine, they manually peruse the article and they tag these articles with certain terms, which they call it as mesh terms. It is nothing but medical subject headings. So this is what they call it as indexing. Indexing is nothing but tagging an article with the major or the key concepts that the article discusses or deals and have been published. So this mesh, since the article is tagged with those terms and concepts, now when we are undertaking a search also, if we use or if we try to tell PubMed, okay, give out such articles which are tagged with this mesh term, it will be more specific and we'll be receiving very specific the articles which are very specifically conducted on this particular topic. So that is what we mean by mesh. And meshes, you will be able to observe these things in the PubMed. I'll show you these things when we are actually moving on to the hands-on part now. So then once you can always identify whether a specific concept is a mesh term or not. Again, I will show it in the demonstration. Then apart from mesh search, you would also do field search. What do we mean by field search? Field search is asking PubMed to search a specific term in specific fields of the articles. Now, what do we mean by fields? Fields are nothing but the metadata which you see in an article. Title can be a field, authors can be a field, journal name can be a field, author affiliation is a field, abstract is a field. So whatever the the individual metadata that you see in an article, that constitutes a field. Now you can instruct PubMed to see specific term. For example, if it is diabetes, okay, search for diabetes as a term in the title or in the abstract. So such things also you can tell PubMed, and it will be able to identify and search and give you such list of articles which is harboring these terms in those specific fields. And we actually recommend at least going for the title and abstract. Whenever you are trying to search certain concepts or terms, please go for title and abstract as a field search. Now comes the next thing. So like I mentioned, there are 4 components, right? PICO. Now we need to merge certain concepts and the keywords. Diabetes may be having more than one synonyms, right? One might be referring it to as diabetes mellitus. Another might be referring to as, patients with high sugar, right? So how to, I need such articles which has either of these two. So that's where we use the Boolean operator called as OR. So it contains at least one term. So it will give many more results, but it will ensure that I don't miss out any articles which harbor either this term or the synonyms of this term. Now comes another Boolean operator, which is AND. So I would be requiring diabetes mellitus as well as hypertensive patients. So the study population in that particular group must need to have both hypertension and diabetes. So there you can combine the hypertension and diabetes, the two different concepts together with the Boolean operator, and then it will give you such articles which talks both about hypertension as well as diabetes. So these are the 4 principles. Never do a PubMed search, sorry, Google search in PubMed, that is full phrase search. Never do it. Always try to get mesh terms and do a mesh search, as well as field search, especially in the title and abstract fields of the articles. Then always use Boolean operators to combine within the same component or between the components. So we will move on to the demonstration. So is my screen visible? Is my PubMed screen visible?
Yes, sir.
Sorry.
Arvind, you will have to stop and then start.
Yeah,
Now it's visible.
It's visible. Okay. So PubMed is a freely accessible search engine for everyone. Medline is again free, but then we need to use one or other search engines for doing a Medline search. That is being provided by PubMed and as well as Ovid, but Ovid is for payment. Only if you pay, you will be able to access Medline through Ovid, but PubMed is free of cost, at least so far. So this is the homepage of PubMed. Once you type PubMed in the Google, it will take you to the first link, which comes as a PubMed link. So this is the homepage of PubMed. So when, like I said, you can, I hope my screen is visible clearly and you are able to see my, the pointer as well. So as you can see, in the homepage itself, you will be able to check whether a specific terminology is actually a mesh term or not. So you can see this mesh database below this explore option. In the bottom, you can see 4 icons, and in that explore option is there, and below and within that explore option, you can click this mesh database. Once you go into the mesh database, it will take you to a page. This is mesh database. So let's say, like ma'am was mentioning earlier, so maybe we can see whether hepatitis is you're trying to do a research that involves hepatitis. Okay, your research question involves hepatitis. Study population is hepatitis patients. So I want to, you need to check whether hepatitis is a mesh term or not. For that, you go into the mesh database, type the exact term and click the search. So once you click, it will show these are the various mesh terms that are related to hepatitis. So if I click hepatitis, now you will be able to read. So this is how you can confirm whether a specific concept has a mesh term or not. Okay. So as it is, if it is a mesh term, you will get a list like this, or else it will display no results found, which means that particular term is maybe relatively novel and they are in the process of creating mesh but not yet published, or it may be not that significant for them to have a mesh term. Anyway, so if it is a mesh term, it will show a page, a descriptive page like this. So as you can see, it's a short description of hepatitis. The definition according to PubMed is hepatitis is inflammation of the liver. And you can also see some of the, this is called as mesh tree. It just shows the hierarchy in which the particular mistom is present. As you can see, hepatitis is somewhat in the mid-level of that tree. And above it comes within a broader classification of liver disease, and it includes hepatitis alcoholic, hepatitis animal. There are a lot of other sub-classification within that. So this is how you will check the whether a specific concept has a mistom or not. If it has a mistom, then definitely you need to include that in your search strategy. Now, how to do the actual search itself? Now, whenever you are conducting a mesh search, it is always advised to go for advanced search and do not directly search in this search bar that is displayed here. Always select advanced search. Okay, then you will be having a window like this. Okay, now before moving on to the search itself, you need to be very clear of two things. One is your research question, which you already might be having. I hope my Word file is also visible, ma'am.
Yes, yes.
Yes. So this is, let's say this is your research question. So I have taken this research question. What is the effectiveness of tirzepatide on the incidence of type 2 diabetes mellitus among people with obesity? Okay. So once you have framed the research question, you need to make a table like this. This is what we call it as framework table, and this is nothing but elaborating your PICO component.
Dr. Arvind, can you just increase the font size on the Word document?
Is it fine now?
Huh.
Yeah. Is it fine now, ma'am?
Fine, fine.
Yeah. So as you can see, this is nothing but the framework table is nothing but the PICO components, which you already know. For an RCT, we describe the question in terms of PICO. So for this particular question, the population is patients are people with obesity. So I have taken the concept as obesity. Now the intervention is the tirzepatide. The drug of intervention is tirzepatide. So I have mentioned it under the I component. Now, the control group for this specific question, I have not specified in the research question, right? So, which means I'm keeping the control group very open in the sense that it can be placebo group or it can be any other active drug such as semaglutide or any other drug which is actually done for that. So, this is sometimes you need to specify the drug, sometimes you can keep it open. So, I have keep it open here. Next, the outcome part, that is O component, which is new onset type 2 diabetes mellitus, not pre-existing type 2 diabetes, but only incidence of type 2 diabetes mellitus in patients in obese patients taking tirzepatide. Now, we need to make this table, and you should make subsequent two columns. Like I mentioned, these two columns are basically for inputting the terms that comes under the search fields. So like I mentioned earlier, it is always recommended to do mesh search as well as field search. Now, in order to do the mesh search, the first step you need to do is that confirm whether it is a mesh term or not. So for that, you can just copy paste the concept. So my population is obesity, right? So I will copy paste in the mesh database and I'm searching. So it is mesh term. Obesity is itself is indeed a mesh term. So I will copy paste it here under mesh obesity. Now, when you go for field search, especially the title abstract search, it's not only this term. It can be some other synonyms because in mesh term is an index term, but which can track out, which can trace out all articles which have been conducted on research which has been primarily undertaken on obesity. Whereas in field search, you should be very specific to the extent that even spelling should be same. If there are multiple or various combinations of the spellings, you should repeat those spelling combinations as well. For example, it can be pediatrics. In pediatrics, it can be only E or it can be PAE, pediatrics, right? So in such scenarios, you need to input both the terms because under the field search, it exactly searches, it is very case specific, not case in the sense not capital or small letters. It is very spelling specific. Okay. So as far as possible, you need to take out all the variations or the synonyms with which obesity can be referred to by various authors in their articles. So article published by you would have referred to as obesity in the title, Okay, an article published by me, I would have mentioned, okay, what is the prevalence of type 2 diabetes mellitus in obese patients? So if you try to search only obesity in the title and abstract, you'll be missing out such articles which would have used the term obese. Sometimes what happens because of the historical studies where as you know, the criteria that is used to declare obesity overweight also keeps changing. Maybe some earlier studies might have had a criteria which is equivalent to the obesity criteria now. So but they might have referred it to as overweight according to the earlier criteria. So it is always better to even use such closely relevant terms or very close classification terms which might be used to actually refer to the patients of our interest. So overweight is one term, and some studies might have used to refer to as high BMI. The point here I would like to make is that you need to try to bring in as many synonyms as possible or related terms as possible to the concepts while you are undertaking field search. Okay, now let's actually move to the search itself. So let's do a search and identify such articles which would have been published on obesity. Okay, so as you can see, this is the PubMed advanced search window. So first I need to search such articles which are being indexed with the term mesh term obesity. So I will type obesity in the search. Now I need to inform PubMed to search obesity under mesh. So for that you have to click this drop down, and once you scroll down you will be able to see these mesh terms. Always choose these mesh terms, never go for major topic or subheading. Always choose this mesh terms. So once you choose this and click add, it will go to the query box. Okay. So once you click add to history, it will show the results. So now I have asked PubMed to give me the results of all the articles which have been indexed with the term obesity. And it has shown me there are around 298,811 articles that are indexed with this term obesity. Can you verify this, confirm whether it is actually giving such articles that are indexed with Medline? Yes. You just click the results, it will take you to the results page of the PubMed. You click one article and every article will have a list of PubMed search. Can you see? It is having obesity as a concept, and that is given under mesh. So this will definitely be there because this is there. We are getting that article. So you can always verify that. Now I have completed my mesh term search. Now I would also like to check whether some of the articles might not have been indexed. Example, PMC articles are not indexed with Medline, right? Mesh terms are only specific for Medline indexed articles. What if the article journal is not indexed in Medline, but only present in PubMed Center? In such scenarios, you definitely need to go for field search. So what do you need to do for the field search? You can type the exact same word, but change the field to title and abstract. Okay. Now I have changed it to title and abstract. So once you click this, it will go here. Now you can add to history. So now as you can see, there are 400,000 plus articles which harbor obesity as a term either in their title or in their abstract. But this alone is not enough. There may be variations of this concept, right? I have already mentioned here. So I will search for all those variations. So I would like such articles which are harboring even obese as a term or overweight as a term, right? Or high BMI for that matter. I would like to have all those articles which have such terms, any of these terms, right? So as you can see, these are the potential articles which harbor the concept overweight. But the key point is that I would like to have a unique list of articles, a set of articles where there are no duplications, because there might be duplications among these results. But I need such a unique list of articles which may be having obesity as a mesh terms, or obesity as a in the title abstract, or obese in the title abstract, or overweight in the title abstract, or high BMI in the title abstract. So in order to make sure you get a unique list of such articles, we need to use this Boolean operator R, because you are telling PubMed to give such list of articles which harbor any of these concepts. Any one of these concepts is present, you will be getting the article. But if both the concepts are present, again you will be getting that article, but only once. So that unnecessarily avoids all the duplicates. So once we combine all these using this Boolean operator R, just by clicking these three dots, if you had observed, now I am getting this final list of articles, 549,842. So somewhat my search is very specific to obesity, as well as it has included majority of the articles that have been published related to obesity. But I'm not only bothered about obesity, there are other concepts. So what are the other concepts? My intervention is tersipatide. So since we have already seen how to search for mesh term, I'll just skip that step. So I will directly enter tersipatide in the mesh term, okay, as well as it can be the title abstract terms, right? So you can always add or Boolean operator directly while you are adding it in the query box. That is also feasible. So these are all other terms. I think these are all some generic or drug names during the trial phase. This might be the commercial name of the drug. So all these are all potential keywords which the authors might have used in their title abstract whenever they are publishing articles related to tirzepatide. So once I have added it, I will add it to the history. Now there are 2,400 articles that have been published related to tirzepatide. But again, that is also not enough. Even though I have kept my comparator open, my outcome, I have a specific outcome, which is type 2 diabetes mellitus. Again, type 2 diabetes mellitus is a mesh term. So we can search type 2 diabetes mellitus. And maybe I will just for the sake of time, I will directly search the term diabetes or high sugar. Okay, let's say that I have exhausted my synonyms, but obviously you need to, So as you can see, the search query number 6 is about my population, 7 is about my intervention, that is tirzepatide, 9 is about my outcome, that is type 2 diabetes mellitus. So, but these are all giving individual set of articles that are focused on that specific concept. But I would like such articles which harbor or which has all these three concepts together. So what should I do? This is where your Boolean operator AND comes. So you are going to instruct PubMed, I need articles which have obesity by clicking these three dots and adding the query to the query box. Okay. I need such articles which has obesity as a concept in them and tirzepatide as a concept. And again, click this three dot against type 2 diabetes mellitus. And you are saying that I need articles which also have type 2 diabetes mellitus. So only if all three concepts are present, you need PubMed to display such articles. Okay. So in order to do that, you need to combine these three concepts with a Boolean operator and Boolean operator. Okay. So once you click add to history, now it will show the final results. Now you can see we started with 549,000. Now it has come to 894 results. So this 894 results are very specific, which can answer your research question. I'm not telling that all these will be eligible. So you will have another step following this called as screening, but this will make your life easier in a way that whatever results you are getting, that they are relatively more accurate, which can help you to again pick up. Earlier you are picking needle in a haystack. Now maybe you have taken out that impossible situation, and the list 894 is not a big number. You can screen through this study, and again you can check for the eligibility using the the research question and the eligibility criteria which you have set. Okay, so if you go into any of these studies, you will be able to find all these three concepts being present either in the mesh or at least in their title abstract. Now once you get this result, you can always download these results. Okay, so how to download these 894 citations, especially in referencing format? So there is this option called as send to here. Once you click this, it will ask citation manager. So it will ask you whether you want to export only the results on this page or all results. Always select all results and click create file. So now it will create a NBIB file, which is PubMed reference file, as you can see in the top right corner. So this file can be imported in your screening software, maybe Rayon, Nested Knowledge, which will help you to screen. Okay. Now, if you remember, I also said search strategies are reproducible and must be reproducible if you are doing a database search. And as you can see here, you are doing a search in PubMed, but you would like to, share the search strategy for peer review. And obviously, journals, whenever you are submitting systematic review, they will ask you to submit the search strategy as well. Now, this is the search strategy, right? The query number 10 is the final search strategy. Now, you need not type everything again in the Word file or the supplementary file which you are submitting. You can download this using this button, and you can see the entire search strategy, the date of search, number of results, etc. will be downloaded as a CSV file, which you can save and share with your peers as well as with the journals. And once, let's say after 6 months, you are coming back and you want to rerun the search, you just copy paste the search from this CSV file. It will give you the same results. Obviously, after 6 months, you might get somewhat additional results, but the point is it is reproducible and you need not spend any more extra time or energy to make it or report it. You can just download it in this CSV file and you can export it. So that's it from my side. So thank you. And if you have any questions, we can discuss.